We're now live. You can proceed, Supervisor Hopkins.
Good evening, everyone, and thank you for joining us once again. Before we get going, I'd like to introduce Gilbert Martinez from our communications team with a message for our Spanish-speaking viewers.
Buenas noches y bienvenidos a la sesión informativa organizada por la supervisora Hopkins y la doctora Mase. Esta sesión informativa se está transmitiendo en vivo por nuestro canal de YouTube con interpretación al español. Para escuchar la versión en español, puede usar el link de YouTube que se encuentra en la página de Facebook del Condado de Sonoma. Gracias. Ahora regresamos para atrás con la supervisora Lynda Hopkins.
Thank you so much, Gilbert. I'm Lynda Hopkins, Supervisor for Sonoma County's 5th District, as well as the Chair of the Board of Supervisors. Welcome to our COVID-19 community briefing for Wednesday, January 20th. Our focus today is a topic that I know every parent, including myself, is tracking very closely: how we're going to get our kids back into the classroom. By the end of this session, we hope that you'll have a better idea of how schools and the county are working together to get our pre-K through 12th grade students back in schools. I also want to remind you that during this community briefing, we will be taking questions from members of the public. You can leave your question either in the comments area of Facebook Live, and we also do accept emailed comments and questions as well. Before I kick it over to our usual presentation from Dr. Mase, I would like to introduce a colleague of mine on the Board of Supervisors, the Vice Chair of the Board of Supervisors and the 3rd District Supervisor, Chris Corsi. And I'd like to introduce him because I think that this topic is near and dear to his heart as the 3rd District representative.
Thank you, Lynda. And I'm really glad to be able to join tonight for a brief while. I won't be here for the whole webinar. And thanks to everybody for joining us. Information is one of the best ways to fight this virus, to make sure that we're all on the same page as we work to get back to a healthy bodies, healthy economy, healthy community. I, like Chair Hopkins, am also concerned about getting my kids back into school as soon as possible. Concerned like you are. My kids are a little older. They're teachers, but they're still my kids. I still care about them. They are anxious to get back into the classroom as well. So I'm looking forward to hearing from Dr. Herrington and Dr. Mase, and I'll turn it back to Lynda at this point.
Thank you so much, Chris. And with that, I will be handing it over to Dr. Mase, who will be providing us with a brief update on COVID-19. And then I believe right after that, we will be hearing from Dr. Shende with an update on vaccination implementation.
Great, thank you so much, Chairwoman Hopkins, and Supervisor Kersey, and Paul. And thank you everybody for joining us this evening. I want to start with a brief update of where we are in the pandemic. And then I will turn it over to Dr. Urmila Shende, who is Sonoma County's vaccine chief. She will provide an overview of our vaccination distribution to date. We continue to see wide community spread of the virus, and our case rate and hospitalizations are still high. Our unadjusted new cases per day per 100,000 residents is at an all-time high at 52.9, and our overall testing positivity is 9.7%. Looking at hospitalizations, there are currently 87 patients hospitalized with COVID-19 in Sonoma County. Our ICU capacity locally is 17.7%, and the overall Bay Area region is still under 15%, down to 7% at this time. We do remain under the state-mandated regional stay-at-home order because our projected 4-week ICU capacity is still less than 15%. Another troubling statistic is the surge in COVID deaths we have experienced this month. At least 48 Sonoma County residents have died in January, the deadliest month of the pandemic so far. And we're only 2/3 of the way through this month. Our hearts go out to everyone who has lost a loved one to this deadly disease. It is yet another grim reminder that the worst days of the pandemic are not over. We need to remain vigilant and practice safe mitigation measures like mask wearing, social distancing, and general hygiene, such as hand washing, for the foreseeable future. So that's the bad news. Now I will turn it over to Dr. Shende, who gets to share the good news about our vaccination rollout.
Sorry, technological issues. Thank you, Dr. Mase. Indeed, there's good news on the vaccination front, which we know is our best tool to ending this pandemic. We've seen a phenomenal uptake of the vaccine in our phase 1A healthcare workers, and now we're working through our phase 1A tiers 2 and 3 population. To date, we vaccinated 20,979 Sonoma County residents as of yesterday. As we work through the distribution plan, we've set up vaccination clinics for various population groups. Some of these clinics have included a clinic to vaccinate first responders at our public health lab on Cheney, Sonoma County Medical Association clinic for healthcare providers organized in partnership with the county, a clinic for in-home support services workers at Sonoma County Fairgrounds, administered by Safeway pharmacists, a clinic for public health field staff at the county administration building, a clinic at the Roseland Library for community health promoters who work in mostly Latinx communities. So it's been quite busy recently. And as we prepare to scale up our distribution even more to the much larger phase 1B population group, we're partnering with many different stakeholder groups to set up mass large-scale vaccination clinics countywide. We've secured sites at the fairgrounds, at the San Rosa JC Petaluma campus, and at the Huerta Gym in Windsor. Sites like these, similar to the way we ramped up testing, will be able to vaccinate hundreds of people per day as we look to quickly and safely get as many Sonoma County residents vaccinated as possible. On our one final note, we're aware that the California State epidemiologist, in an extreme abundance of caution, requested that local health departments pause distribution of one batch of Moderna vaccine due to possible allergic reactions that are under investigation by the CDC, the FDA, and Moderna. Sonoma County did receive 7,500 doses from the lot in question. Some were sent directly to our partner healthcare providers. None of the doses from the affected lot has been administered since this notice went out. I would like to stress that this same lot has been used throughout the state and throughout the country. It seems to only be one vaccine site that was affected. All other people who have received this vaccine and actually received, who were allocated the vaccine and received it, there haven't been any increased concerns noted. So we do not expect that putting these vaccines on hold will slow the rollout process here in Sonoma County, as we have other Pfizer vaccines that we can use instead. Finally, we want to remind people that even after being vaccinated, we all still need to wear a mask and practice safety protocols. The vaccine is very effective, but there still is a chance that those who are vaccinated can spread the virus until we develop true herd immunity throughout the community. And now I'll turn it back to Supervisor Hopkins.
Thank you so much, Dr. Shende. And as a reminder again to our viewers, we will be taking questions in real time, and you can either utilize Facebook Live or you can email publicaffairs@sonoma-county.org with your questions. Now it is my honor to introduce the rest of tonight's panelists, which is in addition to Dr. Mase and Dr. Shende, we are joined by Dr. Steve Herrington, the Sonoma County Superintendent of Schools, as well as Dr. Jeff Harding, the Vaccine Chief for the Sonoma County Office of Education. We also have Adam Radke, an attorney with County Counsel, who has been tracking the state's plan for schools very closely. So first of all, Steve and Jeff, thank you so much for joining us tonight. Really appreciate your participation in the panel. You know, as you well know, and as the community is aware, at the end of December, the governor unveiled his $2 billion plan for reopening California schools for in-person instruction, which he says he is hoping will happen by as soon as February. Is that realistic? And how are you working with the governor's plan to have our schools reopen?
First of all, the governor's plan is a plan and it hasn't been approved, and it's because it's tied to funding. And so it has to go before the state legislature for approval. The reality of February is wishful thinking. It's a benchmark date, and the date for March is wishful thinking and a benchmark date. As Dr. Mase indicated, that our case count is above 40, and we have to be below 25 before schools can even consider reopening, even with the incentive program that the state is offering for school safety to accelerate opening of schools. I think the community also needs to know that every district is required to write 2 other plans. So besides the governor's incentive plan, or safety plan as he calls it, we have the Cal OSHA plan that has to be concurrently developed and worked out with districts. Plus we have the new CDPH document that came out, and it requires additional plans for school safety. So here you have districts working on 2 identified plans and 1 projected plan that will be challenging. I want to say to the community that we have great concern about everyone's safety, teacher safety, student safety, and we also have, we realize the need of the emotional support that families need for school to reopen. We know that in-person instruction is valued and appreciated by all, and the way students learn, it's a component of the learning concept that they need to have in-person instruction as well as online instruction. We're not there yet, but we are concerned about getting back to school. We all want to get back to school. So that's where we are right now, working on 3 plans, 2 defined, 1 yet to be defined, and the dates are still benchmark dates as proposed. But I know, for example, talking to Diane Kitamura from Santa Rosa City Schools, she's getting her plan ready. The problem will be whether we'll be ready, as she told her community, with our case count. And that's where we are.
Thank you so much, Dr. Herrington. Dr. Harding, do you have anything to add as the vaccine chief for Sonoma County Office of Education?
Thank you, Supervisor. I think vaccinating our staff, all of our staff members, that would include custodians, secretaries, teachers, principals, everyone, so that they feel safe going back to school, I think is a critical component to our reopening process. And we're very excited about seeing some light at the end of the tunnel. You know, it's been a very dark time for many months. And I think as we look down the road, it's a realistic expectation that our staff can get vaccinated in the near future. My task is very straightforward: to design a plan as soon as vaccinations become available, to set some priorities, to establish those cohorts of staff members that we would get vaccinated first. The task includes vaccinating preschool, daycares, kindergarten through 12th grade, all the way through the university level, with the priorities being the younger students first, elementary schools, and then eventually secondary and the college level faculty. At this point, vaccines aren't available, but as soon as they are, we'll be ready to set up shot clinics throughout the county. We have a plan that we've laid out with our superintendents and with our private and charter schools as well. And we've, at the Sonoma County Office of Education, taken on the responsibility of coordinating this effort along with our districts and our private and charter schools. So we're moving forward rapidly in an ever-changing environment.
Thank you so much, Jeff. And I really appreciate both of you just leveling with the community, because I think it's really important to acknowledge that where we are. And sometimes folks, I think, read a headline in the newspaper that gives them the impression that, you know, maybe next week we'll open schools and we have plans, but we don't have the actual on the ground reality that's going to enable us to move forward with those plans yet. So we don't have sufficient vaccines to vaccinate all of our teachers. We don't have the transmission rates that would allow us to safely reopen schools. So I know it's frustrating for parents, but I really appreciate you just being willing to tell it to everyone straight. Now, I do have a question about, since the fact that there is no approved vaccine for children under the age of 16, how will student safety be ensured until one is available? And Dr. Mase and Dr. Shende, I'm wondering if you would like to comment on this. Do we need vaccines for, you know, children under the age of 16? And then what about parents who might not be, you know, prioritized on the list? What is their sort of risk if their child is going back to school?
Yeah, so I'll take that first and then turn it over to Dr. Shende. Absolutely, we need vaccines for everyone. And in fact, the clinical trials are now have enrolled children under 16. So we will have data in that group soon, and hopefully a recommendation to extend vaccination for children under 16. And in the meantime, I think we really need to rely on the mitigation measures that we have been adhering to thus far that are also very effective in preventing the transmission of COVID from person to person. And that would be the wearing of the face coverings or masks, the social distancing, that's a cohorting and things that we're doing in the schools to ensure that we don't have too many students in one place at one time. and general hygiene measures. And as we're able to vaccinate a greater and greater proportion of our population, then we'll be going towards hopefully a time when we'll have less transmission, less widespread transmission of COVID in the community. So I will turn it over to Dr. Shende.
I think you said that very well, Dr. Mase. I don't know that I have much to add, except that yes, indeed, vaccine trials are underway now, down to the age of 12 for the Moderna vaccine. It's going to be some time before we have that data back. So the best we can do at this point is wait for that vaccine supply to start increasing and try to vaccinate as much of our education workforce as possible, which is exactly what Jeff has been working towards and has done a wonderful job. It's just going to take time and patience, just as this whole process has. But we're moving forward, and that feels good.
Dr. Herrington, looks like you want to lean in.
Well, yes, I just wanted to reassure parents about the plans, because every plan has in it a component of surveillance testing for faculty I shouldn't call faculty, school employees. And so there's a benchmark measurement for surveillance testing on a regular schedule. There's a recommendation in the California Department of Public Health document. There's a recommendation in the Cal OSHA document. And then in the governor's plan, it's because you're a purple county, you would do regular weekly surveillance testing in his proposal. And so these are tests for both, and his proposal, it goes beyond the employee and it goes to the student. So not only would you be surveillance testing the staff, you'd be surveillance testing the student in the governor's plan. That's why there is additional dollars, because you're now buying larger components of test kits to be done. And so these are self-administered, and Dr. Shende and I and Dr. Mase had a discussion about that today with preschoolers, self-testing. But anyway, it will be an interesting attempt, and but children surprised me. They have learned a lot recently on how to deal with all of this. So that's what we're going to do, is that once the funds are there and available, and we do get to reopen as a purple county, we would have to do surveillance testing on a weekly basis.
It is amazing how adaptable children are. I never thought that my toddler son would be able to wear a mask consistently, and yet peer pressure works. He sees his sisters doing it and he wants to be just like his big sisters. Following up on the testing requirement for, teachers, or as you said, employees of the school, as well as students, what about vaccines? When they become available more widely, are we anticipating having mandatory vaccines? This is a question that we hear a lot from constituents. Will my student be required to have a vaccine if it's and when it's approved, to be safe in order to attend school? Are teachers going to have to face, mandatory vaccination in order to go to work? What are we hearing from the state or locally?
Well, currently the state has certain mandates on educational professionals for testing and for vaccinations as a state requirement. And one of the most common was TB testing and TB vaccinations. Now, of course, that's done through a surveillance interview, but it's a state just would have to make that decision at the legislative level. It can't be made by the local school district necessarily, but it should be made at the legislative level. For pre-screening, for children, it might become, once tests are available, it might be a component of their testing for school admission. So, but we're not there yet. The legislature hasn't even looked at the governor's plan yet. So we've got a long ways to go, but that's what I tell parents. That's not a criteria decided by the school board. It's decided by the state legislature.
If I may add one more thing.
Oh, yeah.
Sorry.
Go ahead. No, Dr. Shende. Yeah, I was wondering if you had heard anything from the medical profession side.
Yeah, so in terms of vaccines in general, under emergency use authorization, EUA, which is how they have been FDA approved, these vaccines cannot be mandated. So it's not until it's gone through the complete FDA approval process, which is going to take some time, that can even be considered. So at this point, for the foreseeable future, there should not be any mandate because of the way that these were licensed by the FDA.
Thank you. One other question that I have, which goes a little bit to what Dr. Herrington was talking about. Obviously, right now we are under a stay-at-home order, but once that order is lifted, we'd still be in that purple tier of the blueprint for a safer economy. Is that right? And what tier would we need to be in for schools to reopen? And then will you be approving these COVID safety plans that each school needs to have, which Dr. Herrington mentioned that there's not just one plan, right? There are multiple plans that need to be in place in order for schools to reopen safely.
Yeah, it's an excellent question, and it is quite confusing. I am actually going to see if Adam Radke, our Deputy County Counsel, can speak to that.
Hi, Adam Radke, Deputy County Counsel. To answer your first question, Supervisor Hopkins, once we exit the regional shelter in place order as a region, then all counties within that region will be placed in a tier. Likely the purple tier, which has been kind of like the experience of Sacramento region, which just exited the regional shelter in place order. Once it's placed in the purple tier, schools can reopen as soon as the adjusted case rate falls below 25 per 100,000 for at least 5 consecutive days. Then they would be allowed to reopen. They can submit a plan before that and actually are required to have a plan approved and posted at least 5 days before they reopen. But they can't formally reopen their school until that case rate has been met for 5 consecutive days.
Dr.
And then,
Herrington.
Yeah, Lynda, what I'd also like to add to that is once reopened or once opened, for many of our schools, it would be open, they would be allowed to operate. And should we fall back into purple, they would stay in their classification as open. So once a district opens, they can stay open. They have to follow the protocols as established, but they don't have to go backwards. And that's why you see Marin County is open and Napa County is open, because they were open when they were in the red. We never made it to red. We wish we made it to red. Dr. Mase and I were talking, we were getting close to red, but then we had a surge. So that's how that works a little bit. You can open, once open, stay open. Now we approved, I think about 9, Dr. Mase may have approved 9 schools on waiver. They now have to comply with all the new rules. The waiver expires February 1st. So they can continue to stay open, but they have to be in compliance with the new set of rules. So once open, you get to stay open. And then thereafter, whatever the variable comes in and out, we just have to deal with that as a color code, but we don't have to go backwards.
Thank you so much for that additional information. You know, Dr. Herrington, one question that I would ask is, I know that you hear constantly, not only from the superintendents that you work with, but also from parents, right, teachers. What's the message that you would give to the community right now? And what are some of the, the questions, I guess, that you're most frequently asked questions, and then the answer that you would give, so that we can just educate the folks who are tuned in here today?
Well, I think the biggest concern that we're dealing with right now is the stress and the social emotional learning loss that students are experiencing. It's having a severe impact on our student population. The adverse childhood experience scale for this county used to be 4 out of 10. After the 2017 fires and the Guerneville flood, it went up to 6 out of 10. Now, since that, we've had 2 additional fires, mass evacuation, and the pandemic. I have great concern, and I think the public should have concern about the social, emotional well-being of our children, because that has a great impact on learning. When kids cannot focus, they cannot learn. So that's what my biggest advocacy right now is behavioral health intervention plans for school. It's not required in any of the state requirements, but my feeling is we've added on to emotional counselors at the county office to help support districts for that purpose, because we see it as the greatest learning impact on students.
I am so glad that you brought that up, and I would love to follow up with you at a separate meeting about the passing of Measure O and how we can leverage potentially some of those funds to support our students, because I worry about the same thing. I mean, our kids have been in trauma disaster mode for much of the last 4 years. And I think that now then shifting to distance learning, losing that, source of identity and community that they come to rely on has been extremely challenging. On that note of, other things that we missed, right? We missed having normal graduations last year, which I know was a hard hit for many of our seniors. Just wondering if we have any sense, maybe this is a question for Dr. Mase and Adam. Do you think that there's some possibility of having some kind of normal graduation process this year, or does that feel like it's out of reach given the current rate of vaccination deployment and infections in our community? What are your thoughts?
Well, I just think it's going to depend a lot on the vaccine rollout, which again, in turn, depends on the availability of vaccine. So the more people that we can get vaccinated over time, the next couple of months, the more likely that we'll have a decrease in our case rates and a decrease in the test positivity. And if we're moving in the right direction, it is possible that by, say, April or May, we'll be in a much better place. But it really depends on the variables that we don't have a lot of control over, like vaccine supply. Now, we're not able to get enough vaccine into our most vulnerable populations and then move on from one tier to another, one phase and tier to another, then we may still be in a position by the time graduation rolls around where we are still in purple metrics. It's all currently now depends on where we are at that time. And there are some moving targets. I don't know, Adam, if you have anything else to add.
I don't.
Thank you very much. With that, I am going to hand the reins over to Paul, who I know his team has been busily compiling the questions that we're receiving in real time via Facebook. And so he'll have some more questions for our panelists.
I would like to just add one thing, Paul, and that is the more people that are eligible for the vaccine, that take the vaccine, the better for the community. So I would encourage everybody who is currently in the phases and tiers for receiving vaccine to get the vaccine. I also want to quell fears about the Moderna vaccine lot that is currently under quarantine. It is the current vaccine that's being given to people, even if it is Moderna, is not that lot. We have ensured that we have found and quarantined all of that particular lot of vaccine that the state has asked us to do. So when the state finishes their investigation, hopefully we'll be able to go ahead and use the rest of the 7,500 doses of vaccine that are currently quarantined. But rest assured, the vaccine that is being given right now, the Moderna and Pfizer vaccine, are safe and effective.
Great, thank you, Dr. Mase. So I think we're going to group a lot of the questions. We have a number about schools and a number about vaccines in general, and we'll take the schools ones first. And I'll direct this one to Steve Herrington and Jeff Harding. A number of people are asking guidelines on when we expect schools might be able to open. And one particular question from Maria is asking, is there any chance that at least high-risk children can return in small cohorts? You have thoughts on that?
That's a district by district decision. A small cohort instruction is not prohibited under the current tiers. So districts are currently doing that. It's the risk factor. And for many of the students that are high risk factor as it relates to health standards, it's not safe. So we have to look at that carefully. But it's a district by district decision on, and each board makes that decision. There are 40 school boards that make those decisions for their community. It's community driven. So that's what the board has to realize. Also, I think boards have liability issues. They have to look at those issues. If you have to look at the safety protocols, and if you don't have all the resources to be safe, then you have other factors to make those decisions. One of the things I would like, and I'll have Jeff address it just a little bit, is, the teachers, we're trying to keep the educational community on our own sites for their own vaccination purposes, so that we're not making it more difficult for the general public. The general public should have access to all the general public sites. We're trying to create our own district sites for testing of vaccination purposes so that we can concentrate and get teachers vaccinated without slowing down the public process, which is currently on the same timeline with us since the governor added seniors in our classification. So we're trying to keep ourselves separate. Jeff, do you have anything to add on that?
Yeah, I can add, Dr. Herrington mentioned that there are small cohorts, primarily of special education students, severely handicapped students that are meeting face-to-face with staff members currently throughout the county. We're going to fast track, prioritize that group and get them, that staff cohort vaccinated as soon as possible, and then move into the elementary grades. The reality is, I think secondary schools, high schools will take a lot longer and are less apt to open as quickly as some elementary, particularly preschools and TK through second grade. We see opening much more rapidly than the secondary schools.
And Paul, one of the things I'm surprised people are asking, why are the concentration on elementary schools? And I think Dr. Shende and Dr. Mase can probably address that, is the elementary student does not transfer or experience the coronavirus as severe as an adult. And that population where they have schools in session have very low transmission rates as it relates to the situation. So the younger the child, the better the opportunity for instruction to that child. And that's why the state has put an emphasis, I think, below case 6, but Dr. Shende's the pediatrician, so she may have more information on that than I.
Yeah, that's absolutely right. We certainly do still see that young kids can pick up and transmit the virus, but it seems to be much less than in older people. And also they recover from it much faster. And they also have a lot to lose. Everybody does, of course, but children are developing so quickly. So I think part of the reason that the state picked that group is because of less transmission, less pathology, less morbidity in that group, less disease process, I should say. And because that group is developing and learning so much that there's even more impact on their ability to reach their milestones. So I think all of these things combined. But yes, that's true. There seems to be a little bit less transmission and less problems when young kids get COVID.
Yeah, well, that's really interesting because we have some are raising the point as to perhaps they're concerned that we are not going to get our high schools open soon enough, and some are making the argument that perhaps older students are better to convince them to wear masks and practice safety protocols, and they may be better to manage. I guess the question is there evidence that the older students they transmit the virus more quickly, or that they're harder? Well, as the parent of a teen, I know it's harder to get them to listen sometimes. So maybe that's wishful thinking, huh?
Yeah, it is wishful thinking, Paul, for a teenager. But first of all, they're social beings at that age, and there's a need for connectivity, and so you can have a lot of rules in place, but we have seen it with the colleges reopening. Young adults were not following those rules, and we had high exposure rates, and we had to close schools down. If you look at the New York City schools, they're where they had the most exposure issues were in the secondary grades. And it was because they changed multiple cohorts. In the new CDPH document, Dr. Shende, actually, it was Dr. Mase who advocated that they put some secondary school models in there as a request to our secondary school districts. And there are some models in there to look at how to reopen secondary schools. They are not very conducive to everybody's style of teaching, but they do provide you some options for opening a secondary school. And it would be more hybrid, Paul. It wouldn't be the regular model of 6-period day and that schedule. It just wouldn't fit into these hybrid models that the state has produced.
Fair enough. We have one comment, a couple comments actually about the mental health issue. And Dr. Herrington, we appreciate you bringing that up. obviously there's a lot of concern out there about the mental health of our students who could be struggling right now. I guess the question is, how are you monitoring that? And once our schools open, will there be efforts made to kind of help students kind of get back in gear? Because there may be some difficulty in transitioning.
There will be difficulty in transitioning, and we are hosting a series of what we call convenings. We convened our secondary schools together to deal with the issue. We've had an increase in D's and F's because many teachers rolled the traditional instructional model into the distance learning model and kept the grading practices the same. Well, if the models change, the grading practices have to change with it. So we've been dealing with that issue. The University of California has flexed its admission requirements because they're seeing the same impact on students. But I would tell you, we have developed, as I said, we've expanded our own services at the county office. We added a behavioral health department. I was a co-signer on Measure O with Congressman Thompson in the ballot initiative, because it's imperative that we have funds that are dedicated to student support, because I think Supervisor said it very clearly, is that, you know, her own kids have been out of school a lot, but the average third grader in this county has never had a normal school year. So from kindergarten through third grade for the past 4 years, they have not had a normal school year in this county. And for this year's senior class, I have great empathy for them. They have not ever met. What would your yearbook look like? It's going to be quite an interesting situation. And so it's really important to me that we do provide outreach services. I know our own county, the county administrative office and the director of behavioral health and I have met because we have great concerns for this as a constituency group that needs service. But I would direct you to our SCOE website, scoe.org. We have an outreach section in there for parents. We have an outreach section in there for students and student activities for teachers, so that they can connect with social emotional development for their children. And we have put a series of resources there for families, because this is so important and imperative that we reach out to this community. But we will have to build in things in our, the governor's giving us additional money, which can be used for mental health support. In fact, the last federal piece of legislation signed by the last Congress has mental health support dollars in it, and districts will have access to those dollars. So there is some designated funds for this, but we also have learning loss. And if you look at it, if you're a third grader and you've not had a normal school year, and before the pandemic, the districts collectively had lost over 700 days of instruction. Now look at it. So we have a lot to catch up on.
But it's funny you mentioned that. I have a senior, my daughter is a senior in high school, and I asked her the other day if I was supposed to buy her a yearbook, and she suggested that they were coming out on Zoom. So I don't know how much that's going to cost me, but I hope it's cheap.
It'd have to be video. I don't know any other way how to do it practically.
It's a lot of Zoom pictures, that's for sure. Well, and then just one question, a number of questions, but I'll group them into one. A lot of questions about when teachers and how they're going to get vaccinated. So whether they should wait, they should get it from their healthcare provider, or whether they should wait and expect to get word from their school district or SCO. Some questions about that.
I'll let Jeff answer that question.
Sure. So we've created cohorts throughout the county. Every school, including preschools, daycares, elementary school districts, high school districts, unified districts, private schools, public schools, are all included in one of these 4 cohorts. So our expectation is that at some point, as soon as the vaccine becomes available, some individual, whether it be the superintendent of a school district or the head of school, if it's a private school, will reach out to all their employees who are eligible for a vaccination, and will have shot clinics at local high schools around the county. In the plan that we've designed, we believe that we can do the entire elementary, preschool, and childcare arena in 3 weeks. It's an ambitious goal. We've got about 40 nurses throughout the county who have been vaccinated or who will be vaccinated this week through Kaiser. That's happening as we speak. So they'll be ready to come and give vaccines to school employees throughout the county. So we're ready to ramp up rapidly as soon as vaccine is available. Steve?
I just wanted to thank Dr. Shende and Dr. Mase because they looked at the school nurses and made them a priority to get them vaccinated. And I want to thank them for that effort because we can't do this if we don't have the key staff people in place.
That's great. Thank you very much. We have some media partners with us today as well. I thought we'll start with Phil Barber of the Press Democrat. Phil?
Can you hear me, Paul?
We got you.
Thank you. I have some general vaccine questions that perhaps Dr. Shende would prefer to handle, but if Dr. Mase or somebody else wants to, of course, that's fine. There's a vaccine is coming into the county through a lot of different channels, obviously, including some of the major hospitals in our county who get them directly. Those hospitals might not begin vaccinating seniors all at the same time. I believe they're all formulating their different policies, and seniors who get their primary care from smaller clinics might be waiting even longer than that. And I'm just wondering, is there anything that the county can do to get involved in trying to ensure equity amongst our senior citizens who have different types of health care, or is that just out of your control?
So I'll answer that. Yes, we realize that the over 65 population is a sizable population within Sonoma County. In fact, there are 102,000 seniors in that group. And yes, we are advising that they see their primary care provider, but obviously this is a big group. So we are planning for large-scale vaccination events that will be specifically for seniors at different locations throughout the county. And these will help to supplement the vaccines that are distributed through the primary care provider's office. In addition, we're aware that there are many seniors who are in independent living facilities or who are homebound, who are unable to get to a vaccination site. We have been in discussions with and partnering with many different groups throughout the county to be able to identify these groups, to be able to reach them. We are doing our best to try and make sure that everyone in Sonoma County has access to the vaccine. So over the next couple of weeks, these plans will become more public as the details are unfolded, and people will see that there are options that are out there, and we are very aware of the anxiety, the concern, and the how will I get my vaccine. It will become available. We all still need to be patient because the issue is the vaccine supply. But yes, other options, other opportunities for receiving the vaccine will be available.
Great, thank you. And I know that Dr. Mase and others, I believe you as well, Dr. Shende, have said you've been hoping for end of January, beginning of February to start reaching some of our seniors. There's been some disappointments in the supply chain since then. I know that it came out that Alex Azar's announcement of immediately releasing more doses on a federal level, it turned out maybe there weren't as many doses in supply as they thought, and now this Moderna lot has been set aside. Are you guys still hopeful for end of January, early February for seniors in Sonoma County?
Well, we've certainly started with the senior group already. So it's not, a linear process. We are going to the most vulnerable population. In fact, the prioritization based on age is probably the likely way forward, even from the state guidance. So as you probably know, Kaiser, Sutter have already been vaccinating their 65 and older group. So we've already been reaching out to that. The CVS Walgreens federal program has been reaching out to the skilled nursing facilities primarily. In fact, many of them have had the first visit already. So it's sort of a process of ensuring that the most at risk get vaccinated to the extent that we can moving forward. Are we worried about the vaccine supply? Absolutely. And is the fact that we have to quarantine 7,500 doses of Moderna vaccine affecting the rollout? Yes, and we're hopefully going to get good news about that soon. We'll see. But we are already reaching seniors and will continue to prioritize seniors and move forward.
Great, thank you.
Okay, let's go to Tyler Sylvia, the Press Democrat. Tyler.
Hello, can you hear me?
Yep, you're on.
So Dr. Mase, on alternate care sites, we're in the worst part of the pandemic to date, and the county's alternate care site in Healdsburg is less than 1/3 full with just 18 people using it. Why do you think that is? And does that contribute even partially to the ongoing heavy caseload?
Well, the alternate care sites are there for people, as you know, Tyler, that need to either isolate or quarantine or feel like they have no place to do so safely. And it's really upon the individual to decide that they want to go to the alternate care site. We offer the alternate care site to everybody who's diagnosed and all of the contacts as well. I think the convenience factor is one, and other people would rather stay in their own home while they're isolating to be more comfortable, or whether they're quarantining. I'm not sure that the fact that the Healdsburg location doesn't have 30 more people there is contributing heavily to the surge. I would think it's more just the widespread nature of COVID in our community right now. We know that the things that have led up to that are likely gatherings, travel, and outbreaks in different sectors. So that's probably more of a concern in terms of why we're having such a big number of cases than the fact that we're not filling the alternate care site.
And then just one follow-up, if you don't mind, is what do you think the county has learned in terms of the need for alternate care sites and surge capacity compared to maybe their level of importance that we considered in March and April when we pursued a partnership with Sonoma State University?
Well, I think the alternate care site is absolutely key because there's people who are either have unstable housing and have nowhere to go that do need to isolate or quarantine. And there's people who don't feel safe being in their homes to isolate and quarantine, either because they have other individuals at home that are at risk, or they don't have a separate bedroom or a bathroom. And I think the alternate care site has been incredibly helpful for that group. In fact, the census may be low now, but it has largely been on the high side throughout this pandemic. The partnership with SSU was fantastic at the time. We needed more places for people to isolate and quarantine, and it offered a good alternative for people. We are continuing to contract or look for contracts with other housing units, whether they're hotels or other facilities for alternate care sites. So I do think it's important to have those in place for people who need them.
Okay, thank you.
Okay, and Martin, you had some questions?
Yeah, hi, Dr. Mase. Hello, everybody. I'm working on a story taking a look at how our contact tracing programs or processes have evolved, given the number of cases that we now have. Back in the summer or in the late spring, it was all hands on deck when it comes to contact tracing and trying to get every single case that came across that was confirmed to get a sense of where that virus is moving. And now, given the sheer number of new cases, it's impossible to do that. Can you talk a little bit, Dr. Mase, about how it has evolved? Because I think there's still the impression out there in the public that we are jumping on every single case and giving every case the same priority.
Yeah, we're trying to reach everybody to let them know, obviously, that they need to isolate. We're also trying to elicit contacts from every case to tell them to quarantine and to get those folks tested. But we are prioritizing outbreaks, vulnerable populations, over those people that aren't involved with large outbreaks or are younger or wouldn't potentially have as outcomes that we're seeing in more vulnerable populations. We're also relying on some of our healthcare partners, our hospitals, for example, Kaiser Sutter Memorial, to inform and their contacts to cases and follow up with them. And they have been doing a great job jumping on top of their own cases, notifying them of isolation and quarantine for contacts. So we are shifting some of the workload to our healthcare partners, and they've been very happy to step up to the plate and do that for us. But we're still trying very to be vigilant about notifying cases.
And as a follow-up, you mentioned sort of shifting some of the work to our healthcare partners. Are we doing the same thing with some of our businesses that have have outbreaks, or are there resources that we can give them to sort of try to figure out, because they know their business is better than the county does?
Yeah, more resources are available for testing for businesses. We do have a partnership now with businesses, with OptumServe. We're able to offer potentially the mobile van service for businesses that need to test large groups. So definitely, I think our partners are stepping up to the plate to help us with contact tracing, testing, et cetera.
And just lastly, do we need more contact tracers, even though it's not as effective now as it was back in the summer or late spring?
Yeah, you know, I think we can always use more contact tracers, given that we have a lot more contacts to trace and more cases to reach out to. I wouldn't give up entirely on contact tracing. I still think it's effective when we inform people that they are a case, need to isolate, or they're a contact that needs to quarantine. So I think that has to be a parallel effort, but we are shifting some of our focus, a large chunk of our focus in public health, to vaccination and coordinating that effort, because we realize that, especially with the surge in cases that we've seen, that really the way forward is in getting people vaccinated.
Thank you.
Okay, we're nearing the top of the hour, but we're going to have time for just one more question, and it comes from Crystal from Facebook. She's asking why, if the vaccination is the best tool to combat COVID, why is a mask still being recommended for those who get vaccinated? Dr. Shende or Dr. Mase, do you want to take that one?
Yeah, that's a very good question. One would think, one is kind of led to believe that a vaccine is going to cure everything. However, we know that vaccines are not absolutely 100%. And so it's extremely important to continue maintaining preventative measures with mask wearing, with hand washing. One never knows. And with this vaccine, even though it's extremely effective, we also know that it's extremely contagious, and it's a very stealthy virus. So even though the incidence of transmission will be significantly less, even if one gets a very mild case of COVID from after the vaccine, that still could be contagious to others. It'll be much less. There's much less chance that one is still going to pick it up. There's much less chance that if one does get it, that it would be passed on, but we don't have all the data yet. And so we need to continue to have vigilance to prevent the spread.
And we also need to remember that there's 2 doses. So after the first dose of the Pfizer vaccine, you're only, it's only 25% or so effective. You've got to get that second dose to reach the efficacy of 95% from the studies. Moderna vaccine is more effective with the first dose, but still the second dose is what gets you to 95%. And there is either 21 or 28 days between the 2 doses. So as Dr. Shende said, some of the people who have gotten COVID after the first dose of vaccination have just been spared a more severe form of COVID infection from having gotten the first dose, but they've still gotten it. So I think it's really important for us to include, continue all the mitigation measures. And remember, the vaccine rollout is steady, but it's going to take time. And for the community's sake, it's better for us to all still really adhere to those mitigation measures we've been talking about from day one.
Great. Carrie Benefield, did you have a quick question? We're running out of time here.
I do. I promise I'll be quick. Thank you. It's for Drs. Shende and Mase. Dr. Herrington pointed earlier in the talk to the 40 districts, 40 school boards, and the decision, especially for special ed and small cohorts, the decision being theirs. Can you two, on a medical front, does this make sense to you? I mean, is there a better way to do this than have 40 school districts and 40 school boards navigating this and trying to make these decisions as unique bodies?
So I think the question was, if there are so many school boards at the same time trying to make this decision, is there a smoother way? I wasn't quite sure.
Yeah, I mean, just from a medical standpoint, not a bureaucratic or anything, but when you look at that and you look at 40 school districts and 40 school boards trying to make these decisions unique and discrete on their own, is there a better medical way to do that if, from a medical front, not a bureaucratic front?
Well, I mean, I do think there's some centralization of decision making. It's not like everybody's reinventing the wheel necessarily. So, Carrie, I think there is some centralized process that's still controlling what our school districts do. I don't know, Dr. Herrington, do you agree with that?
Yes, there's a cooperative effort between the school districts to meet and discuss the problems and try to address them collectively. Just like we're trying to do vaccines as a collective effort. We don't want to get out of order. We want to respect the processes and the steps that are established. But once again, it deals with local control issues. And we are, both Dr. Mase and Dr. Shende and I have talked about staying in our own lane. I defer to all the medical issues to her because she has the expertise. When it came to schools, cohorts and the secondary school plan, she deferred to the educators. She just gave them the advice of what is the safest methodology by which to run a cohort, but she didn't try to get into the way of managing the school system. And I think that's the best way we can work. And respect the authority of each of the individual communities.
Okay, thanks everybody, appreciate it.
Yeah, Carrie, I think that gets back to the fundamental question of why we have 40 school districts in the first place. But that's for a different meeting. Listen, thank you all. I know some of us have to jump off for another meeting, but I'm going to turn it back to Supervisor Hopkins.
Thank you so much. And I just want to say thank you so much to all of our panelists, Dr. Herrington, Dr. Harding, Dr. Mase, Dr. Shende, Adam, really appreciate your participation. And I'd also like to thank Jordy, our interpreter, and Odie, our ASL interpreter. I would finally encourage everyone to go check out socoemergency.org/vaccine for more information on the vaccination rollout. Information literally changes day by day, and we work very hard to try to keep that website updated with the latest and greatest information. And of course, we will be here, same time, same place, next Wednesday at 5 p.m. for another one of these live community briefings. Next week, our subject will be on ensuring equity in our disadvantaged communities as we go forward with the vaccination rollout. So please be sure to join us for that discussion. Until then, have a good week, stay safe, and most of all, I know we don't want to hear this, but be patient. Those vaccines are coming, but we just don't have them the sufficient supply today. So more hopefully will continue to come in the weeks and months to come. Take care, everyone, and be well.